Good morning, everyone. Thanks for joining us for our third and final lecture, virtual lecture of 2021. If you're new here, we usually do these in person in Waltham, as we've done in past years, but everyone's had to shift over the past year, so we've been doing them virtually, and it's been pretty great. We do share the recording after on YouTube, so probably by like late Monday, early Tuesday, but you'll all get that in your survey email that I'll send out as well. If you aren't new and you've been here before, thanks for joining us again. What we'll do is we'll go in order as it was listed. So Dr. Geminiani will start first. She'll share her screen. And then after she speaks, if you have any questions related to what she talked about, she can address those. And then we'll go to Amy and Ariel, and it will be the same kind of structure where there'll be a Q&A break after each presentation. And then if you have some remaining questions at the end for any of them, feel free to bring them up. We will try to stay on time as best we can. But we understand if we're a little over and you have to hop off, that's fine. If you have any remaining questions, you can always email me at hello@themichelicenter.com, and I will send it to any of the speakers. So without further ado, Dr. Gem, I will spotlight you, and I'm going to hide the rest of you. And
Okay, so share my screen now?
Yep, give me 1 second.
Oops. There it is. Okay. Can we see that, Stacy? We're good? Okay. So thank you again for joining us early on a Saturday morning. Like people don't have better things to do, right? But we're excited to talk about anatomy of the figure skater. I'm going to talk sort of about some general concepts that I see from a clinical perspective, and then Amy is going to discuss some of the biomechanics analysis of figure skating moves and address some of the things that we hope to look at in the future. And then Ariel is going to talk to us about how do we train to better prepare. Once we understand how the skater has to move, how do we train to prepare better? And that's the whole point of doing biomechanics and analysis like this. Okay, it won't advance. Hang on. I'm not. Oh, there we go. Sorry. So it would only be appropriate to start with an anatomy-based slide for a lecture of this title. And as many of you probably know, the skeleton has 206 bones. Those bones are held together and connected by ligaments. But then there are 850 muscles that operate to actually create movement, and these muscles are stimulated by the nervous system. So this is the human body anatomy, and movement is a structural integration of both neurological and the musculoskeletal systems, and so that will generate the movement. So that's the thing; those are the things we have to keep under consideration as we're analyzing. Skating movement has 3 different types of motion that are part of it. There's linear motion, which is distance moved on the ice. And so you can have measure speed, velocity, acceleration, deceleration, changes in the rate of velocity. Angular motion describes the rotation of the whole body or a segment of the body. It doesn't have to be, it can be one body segment can move in one angular direction and another can move in a different one. And then projectile motion, which most of us are probably most familiar with, launching ourselves off the ice or the ground, as the case may be, and creating projectile movement. So while executing a movement in figure skating or in any activity for that matter, you've got to maintain control of the body as it responds to the forces that are acting on it, such as gravity or the muscle contractions. In skating, we have the added challenge, if you will, of having to maintain an edge. So there has to be a certain lean and balance over that edge to execute well, anyway, the skating movements. So alignment is, of course, as you can probably imagine, very important for staying aligned on the, or staying balanced, find that sweet spot on your blade. All the skaters are going to know what I'm talking about, right? Where you feel just secure. If you have correct alignment of the spine, and that's created by the muscles and balance of the contraction of the muscles, that allows efficient motion at the hip and through the spine. And the spine is designed such that there are natural curves in the spine that allow for distribution of forces, especially with landings. And if the spine doesn't stay balanced, then we can have a more complicated response to those forces and gravity, and that creates these imbalance patterns, which we'll talk about in a minute. So I picked Dorothy Hamill because she was a very beautiful skater. And you can see that she has pretty much perfect alignment. So her center of mass, which is science terms for the center of the body. People have mentioned that probably to you guys in dance class or on the ice. Where's your center? Find your center. Your center is your center of mass. That's where everything is distributed evenly around that center. And then just with a regular simple glide, we have the forces of the ground reaction pushing up from the ice, and then body weight then pushes down. And those are the forces that will help generate movement. So we have to keep this alignment in mind as we continue to train and learn how to do skating skills. As an example, Scott Hamilton, when you have to stand on one leg like Dorothy did, and like what Scott is demonstrating here, you have to stabilize the spine, but also the pelvis and the hips, okay? So in order for that to happen, there's a lot of muscular activation that has to occur. So on the skating leg, the hip abductors, like the gluteus medius, have to activate to balance and prevent things from falling over. In the unsupported side, you have to use some of your abdominal muscles as well as some of the lower back muscles to keep the extension. And then on the extended leg, on the free leg, you have to use the gluteus medius to actually extend the leg, move it out to the side. That's what the gluteus medius does. So we know these things just by research of physiology and how muscles work. So you need to have proper flexibility to get that spine aligned correctly, okay? And if the muscles aren't flexible, it's going to pull the spine into a misalignment. You need then the strength to maintain that correct alignment through movement in the free leg with body rotation, changes of edge, feet, direction, all kinds of very complicated motion, as you all know. The hip flexors are a very strong, large muscle, and they tend to like to do all the work. And if the body is out of balance, the hip flexors will jump right in and try to do the work. And that sounds like a great thing, except that it then requires compensation of other muscle groups. So we have to be careful about that staying very flexible, but stand strong, but not overwork and try to do all of the work so that the body can stay in balance. So I'm going to show you a video of Jason Brown. I'm a huge fan based on just his beautiful skating. And I want you all to watch how he stays aligned through pretty much every movement he makes, including jumps, over that skating side. That doesn't waver for the whole 2.5 minutes. It's kind of remarkable. This is from 2020 Nationals. You see how everything he does is right over that skating side. It's controlled. And that just makes such fluid movement and makes it look easy, which of course we all know it isn't. But he never faulted in that jump from being over that skating side. That's what has to happen ideally for skating to look like this. Now, obviously he's worked for decades to achieve this, but I think it's a lesson learned for all of us. And even on the axle, there's no skid when he takes off. He goes right into the circle rotation, and the flow out of his jumps is equal to the flow into, which is why he gets such high grades of execution. Even if he's not doing all the quads, he's getting huge grades of execution because of the quality of what he's doing. And you can see that the free leg never kind of flops around. Again, just beautiful flow in and out of that. And going into the spin, I was observing when I was monitoring or covering these skating events in the last few weeks, how many skaters were executing very difficult jumps, but they couldn't control the edge getting into a spin. I was kind of surprised, actually. It was very striking to me. And it was not just one or two, it was skater after skater after skater at, you know, novice, junior, senior level even. Watch every move he makes. He doesn't lose speed doing his skating movements. And you can just feel that he has never wavered from being over that skating side, and he can very efficiently shift from the left to the right as he changes direction, changes skill. And his spins, for the most part, are pretty well centered. And there's no altering between changing positions, which you often see. So I think he is just an excellent example of what figure skating should be in terms of the basic fundamentals, especially. And we know that figure skating is a very complex pattern of movement. We just watched that with Jason. And there's a lot of joints involved, directions of movement, changes quickly, and multiple series of movements. But to do it effectively and efficiently, you need that control with the fundamentals. So the fundamentals of figure skating are strength, flexibility, agility, and core stability. And really that's the fundamentals of any sport, but especially in a sport like ours where we have to balance on that blade. You know, even a little bit of a shift is going to create a big problem, especially in jumps. So strong fundamentals create the ability to control edges, and that can not only improve performance of skills, jumps and spins, turns, step sequences, as Jason demonstrated. But our hope is that that would then prevent injury. If you're not struggling and the body's not fighting itself, then we hope that that leads to consistent execution of proper technique. And Nathan in the middle is demonstrating, you know, the edge into the axle. Obviously, that has to be stable. Any jump edge entry has to be stable. If you're not stable on that edge, how are you going to lift yourself into the correct position in the air? So that's why we have to focus on those types of movements and how do we make those better. And I just want to also point out that if you're doing that incorrectly and your muscles are working and compensating, that's a learned pattern that your muscles will have. So, you know, I see many skaters repeatedly trying a jump, and obviously you have to practice to learn, but, you know, doing the same thing over and over and over, you know, that doesn't help you. That teaches your body sometimes how to do it wrong instead of doing it a few times, going to something else, coming back, try to relearn. So I think that's a strategy that should be considered for training. So we talked about, we saw what's supposed to happen, but when we talk about imbalance, which happens a lot of the time for those of us lesser beings in figure skating than Jason, the body has to be balanced, okay? The spine has to be lined up, but in order for that to happen, the muscles have to balance from the back to the front. And this picture on the left really illustrates how those back muscles, they're doing all the work, right? Because everything in the front is just letting that follow, okay, instead of controlling that extension movement. And this is the pattern of movement that will get skaters in trouble with stress fractures in their back. And we have to remember, it's not just about the hips or the back or the spine. Everything is connected. The hip and pelvis and the spine have to work together. What one does affects the other. If one's incorrectly aligned, the other's going to try to compensate. And that just creates difficulty. So, as I said before, if you're doing incorrect technique and you're just trying to get it done because you just want to get it done, that's often it's a drive. That's what you want to do. We're most of us very type A. We want to do a good job, so we want to make it happen. But doing it or trying almost too hard can lead to those compensation patterns, and then that leads to overuse. Okay, this is especially important in the growth spurt time frame, where you have a change in the bone growth rate. Obviously, bones grow, but the muscles and tendons take about 3 times as long to do that same degree of growing. And so there's automatically right there a challenge with flexibility, okay, even if you did everything else right. And that's just physiology. That's what's supposed to happen. So we have to be mindful of maintaining that flexibility. And when you lose flexibility and you've got a new structure, strength also goes. So we have to make sure we're continuing to build flexibility and strength through the process of growth, which then allows the skater to develop good fundamentals. And we know that attachments of tendons on the bones are growth plates until you fully mature skeletally. And if everything is under a lot of tension and muscles are doing things that they're not supposed to, that creates a vulnerability at those bony attachments. And so we see a big problem in all athletes at this growth phase of those tendons pulling away or stressing that bony attachment. And that creates a lot of pain and dysfunction. So I think Bielman probably is the epitome of describing imbalances. When Denise Bielman did this years ago, and I'm old enough to remember, she was extremely flexible to a point of hypermobility, meaning her joints were very loose. So she had that advantage, but she also was incredibly strong. So she could control the movement. What's happening here is just, people pulling things in directions that they probably shouldn't go. And that's going to create those compensations and those stressors. I mean, doesn't your back just hurt watching some of these ladies? You also need to be mindful of, as you're learning, this young lady down in the bottom in the black and flowered dress, she's leaning off of that skating side, trying to get into a spin, and that's just not going to work. So these are the things we have, the detail that we have to pay attention to. So for sports science, as part of sports medicine, we apply the physics of movement to maximize the human body function. So we want movement to be efficient. That makes sense, right? That's what the body likes to do. We want stability, as we've talked about, and we want to distribute the stressors throughout as many tissues as possible and the tissues that are designed to take it. And so that's how we prevent injury. So we translate what we learn about sports science and movement, both efficiently and inefficiently, to help us identify where there could be risk of injury. And I think for the future of figure skating research, identifying the mechanics of proper technique. And I think when we can look at the biomechanics of efficient movement based on science, then we can identify, hopefully, what's a better technique. And it may be something different for each skater. There may not be a standard, okay, this is how you do it, but you've got to find that for each individual skater. And of course, the goal is to prevent injury as well as improve performance. So one example, and I know Amy's going to talk about this more, is called the moment of inertia. Okay, so in order to rotate efficiently in a spin or a jump, you need to have a small moment of inertia. Okay, so there's the center of mass that we talked about earlier. Okay, if you're going to rotate fast, you need to have as little sticking out from that center of mass as possible. Okay, and so the more things you have sticking out, like Mariah is showing us on the left, elbows and such, that's going to slow down your rotation. Okay, she since has learned, of course, very efficient moment of inertia and stability, being able to then do the triple axel. Gracie on the right is showing us very tight rotation, which makes her technique so wonderful to watch. And so ideally, the moment of inertia is 0. That's probably impossible to achieve as a human body, because we're not just one skinny little line. Although, you know, I think there are many coaching philosophies that, okay, you just have to be smaller. That's how we get this done. You have to be smaller. And that will make you rotate faster. But how are you, if you're smaller, you may not have strength or the muscle mass to stabilize yourself to execute it anyway. So it's not only about staying small in terms of your size, but staying small in terms of height. And height requires strength in the muscles. So I had the good fortune of training with Gustav Lucy back in the 70s. And he was very, very detailed about his technique and almost to the point of biomechanics, which I think is why I kind of got interested in a lot of this stuff, because of how I was trained. You know, we would spend, sometimes I would spend half of a lesson standing there trying to figure out where my arms were supposed to be. And he got into that nitty gritty detail to make the execution of the jump most efficient. And so this is why I'm excited with Amy and the rest of the team that we'll be able to hopefully analyze. I mean, he would describe these things. He's got videos and books, but, you know, I think if we can scientifically show what needs to happen and how we can maybe analyze that for skaters, figure out how we make this more efficient. And then we can train both on and off the ice to prepare for that. And I think that's our goal for injury prevention as well as improving performance. So that's all I had. I was trying to keep it short so Amy could talk a lot about biomechanics. All right, should I unshare, Stacy?
Yes, please.
Unshare, wait, hang on. Oh, here it is. I'm sorry, again, I'm old and these things are tough for me. Okay, it looks like a question. Are you doing this, Stacy, or am I looking at the questions?
I can either read them to you or you can.
Oh, what is skating side? Excellent question. Skating side is where your weight is on the ice. So if you are, we have to remember always we're supposed to be skating on a circle or a curve, okay? So the skating side is basically in your standing leg, okay? In dance, they refer to it as the standing leg. We say free leg. In dance, they say gesture leg, if that helps in any kind of reference. But standing leg or skating leg is where your center of mass is balanced and aligned. Does that answer the question?
If anyone has any more questions, you can submit them through the Q&A box at the bottom. Mm-hmm. And if you have some for later, we can always move on and then go back. Oh, another one came in. Oh, she said, yes, that answered.
Yes, yay, good, thank you.
Give it one more minute. We will have time for questions at the end too.
Yeah.
If you want to move on.
Sure, that's fine.
All right, I'm going to unspotlight you.
Okay. Oh, okay. There's a question here. You're seeing any changes in frequent injuries with having the breaks in training in many scales? Yes, absolutely. I think it's a combination. I think probably majority of injuries we see are overuse. And what happens, and we know from analyzing and observing with overuse injuries, if the training volume goes up too quickly, what happens is the body's able to, when you train, you put some stress on tissue, and then the body heals that in a recovery phase. If there's more training before the recovery phase can complete, that creates overuse stress on the tissue structures. okay? So it's just again, an imbalance of the amount of stress placed on a tissue versus how quickly the body can recover from it. And I think with the break that we had to have with the pandemic, that, I mean, there was no other way, but, other thing that was going to happen, except that the athletes in all sports were going to get deconditioned, okay? And they did. But then when they went back, there were only a few very intelligent coaches, or I can't even say it, one sport did it right. A few coaches did a very slow progression. And, kids were excited. They wanted to get back. And so they just jumped into doing what they were doing before they stopped 8 weeks before. And so that's just going to add too much stress too quickly. So I would say, and based on our clinic schedules, and I know if my colleagues and I have discussed this informally, that we're just seeing a tremendous increase in the number of overuse injuries. I mean, we see it every change of season, because kids either transition from one sport to another, or they only do one sport in the season. And so they just start out, they don't prepare, build up. Cross country is one of the big offenders. The kids, sit around all summer and then they start running 5-6 miles a day. That never goes well. And so we end up seeing them for the injuries. Drew had a question on the growth time. So, everybody grows at a different rate, Drew. So if the bones grow, say, 3 inches over a 6-month period or a year period, which is a fairly good growth spurt, in that same time, the muscles and tendons are only going to grow 1 inch. So now you've got a lot of tension on the muscle from the connection of the bone, because the bone got longer. Okay, it's like putting tension on a line, for a boat or something, and it takes longer for the muscles to grow and catch up with what the bone growth did. So we tend to see more issues with this when people have those rapid growth spurts. There are some folks that grow just at a kind of slow, steady rate, and there's no like dramatic changes, and that sometimes is very helpful, actually. But there are others that grow, I've had some kids come in and grow 6 inches in a year, and they're just hurting everywhere. And, there's nothing you can do. That's what happens physiologically. And you have to kind of manage each individual based on their pattern of how the growth happens.
Great. I think we will move on for now. And again, if there are remaining questions, you can throw them down in the box and we can answer them as we have time. So we are going to move over to Amy.
All right. So let me share my screen. All right. Okay, so thank you everybody for joining us today. Dr. Gem, well done. I'm gonna just jump into it and we're gonna talk about some jump biomechanics today. So we'll start with what is biomechanics. And biomechanics is the study of forces and their effects on living systems. And this is a really powerful tool that we can use to objectively observe, evaluate, and correct movement patterns. So if you've ever found yourself asking, like, why do I hold the bat this way? Or how can I spin faster or jump higher? These are questions that sports biomechanists answer. And we do this by studying forces in the motion of athletes. And we do this to improve performance, prevent injuries, and we can even improve equipment design. So now, like I said, I want to talk about jump biomechanics today. And that's because these are really complicated technical elements where height, distance, and the number of rotations will decide the difficulty and ultimately the score of jumps. So all in all, skaters need to maximize their level of difficulty, and that involves practice and repetition. So skaters can easily execute at least 50 jumps in a single practice session, And we know that from the literature that there's a link between the increased repetitions and increased injury rates. So understanding biomechanics and jump mechanics can really help skaters with training progression on the ice as well as off the ice, but more so that they don't have to do as many repetitions. They can master the jump more efficiently and ultimately minimize their potential risk for injury. So let's look at a jump. This is a time-lapse figure of a skater performing a triple axel. And I could spend like over an hour breaking down all of the mechanics of a jump. But since we don't have that time, I want to keep it pretty simple and go over some of the physics that will sort of govern what a skater needs to do in order to successfully pull off any jump in the sport. So some of the factors that we'll be talking about today, they will need to be generated slightly differently if we're talking about another kind of jump, but I want to focus today on axles, and that's because these are the most widely studied jump in the literature right now. So if we take a look at this photo, you can see there's a lot that's going on in a short amount of time. And the jump, it takes less than a second, but the skater needs to be able to jump up high enough to rotate 3.5 times around and then land without falling. So ultimately, skaters need to find a balance of being able to jump high, rotate really fast, and then align their body for landing. So let's talk some physics. Some of you may know Newton's third law of motion. This is the law of reaction, and it states for every action, there's an equal and opposite reaction. So if you're a skater and you're pushing your skate down on the ice, that means that the ice is pushing up on your skate with the same amount of force. And this principle, or this law, is integral for understanding jump mechanics, especially in the takeoff and the landing. So let's take a look at the takeoff. We've got the same figure here, but I've just kind of isolated it to the beginning of the jump. And this portion of the jump is really important for us to study because it's critical for developing vertical velocity and angular momentum before the skater leaves the ice. So vertical velocity, this is how fast a skater can travel in the vertical direction. And it determines jump height and ultimately how much time a skater has in the air. And then angular momentum, this can kind of be thought of as like a spin potential or spin energy. And it's really this energy, this momentum that fuels angular velocity once the skater's in the air and allows them to spin really fast. So as the skater is approaching the jump, this is the time that they need to really build up that angular momentum. And there's a number of factors that go into generating it. We would want to look at like what the skater's body position is here at the beginning of the approach, and then how the body position changes at the moment of takeoff, as well as the force that they're able to create against the ice as they're leaving the surface. So essentially, as the skater's coming up off the ice, they have to push down so that they can maximize vertical velocity, but they also kind of need to push off almost sideways so that they can begin to start rotating. And what we need to know about the takeoff also is that once in the air, vertical velocity and angular momentum cannot be modified. So you're kind of stuck with what you generate here. So it's really important that skaters are able to maximize both of these efficiently so that they have enough time in the air to complete all of the revolutions necessary. Now, there's a couple of things that skaters can do to maximize angular momentum and vertical velocity. And it may be kind of counterintuitive, but in order to maximize how high you jump, you really have to be able to push down harder instead of up. So We can see in this figure again that the skater approaches the jump in this kind of crouched position. The left leg is flexed, the arms are swinging down, same with this right free leg swinging down, and then right before takeoff, the left leg rapidly extends. The arms pump upwards and that right leg kind of swings around and up. So as that left leg straightens rapidly, it pushes down into the ice harder. Same thing with the arms in the right leg. By swinging down, they're creating a larger force against the ice. And we know that the more force that they can exert into the ice at takeoff is the more force that they're going to have to propel them upwards. And so we know from the literature that just that arm swing alone can gain a skater 8 to 10% more in their height. So that's really helpful. And then additionally, for angular momentum, swinging that right leg around and kind of like she's starting to rotate at takeoff with her hips and her torso. And all of those are helping to generate more angular momentum to begin that rotation in the air. So now that we've gone over takeoff, let's start to talk about what happens in the air. So like I said before, once a skater is in the air, they're stuck with however much vertical velocity or angular momentum that they've created in takeoff. And we know that vertical velocity means the more that you have means more height and ultimately more time. But how does a skater use angular momentum to rotate? Well, before we kind of get into that, let's talk about how angular momentum is conserved. So that means the amount of angular momentum that a skater generates here at takeoff is the same amount of angular momentum that they'll have in the air. So then again, how does a skater use this momentum to spin faster? And like Dr. Jem talked about, this is going to be their moment of inertia. So this is the only thing that a skater can modify while they're in the air. So when we're talking about rotation, moment of inertia essentially describes how easy or how hard it is to spin an object. And it has to do with their mass and kind of the distribution of their mass from an axis of rotation. So if we look at this skater, they have a large moment of inertia with their arms extended wide, their legs away from the body. And that's going to result in a lower angular velocity. So they're going to spin with less speed. Whereas a skater with a small moment of inertia, the arms are hugged tight, the leg is close to the body. It's going to result in a higher angular velocity. So again, since time in the air is so short, it's really important that skaters can get into this tight position as quickly as possible so that, again, they can have enough time to complete all of those revolutions before landing. Now, we do have some studies from the literature. This was done by Dr. Deborah King and her colleagues out of Ithaca College. And they did a study measuring these things. So jump height, moment of inertia, angular momentum in skaters performing single, double, and triple axels. And what they found was that height increased by about 10% from single to triples. So they absolutely jump higher when they're performing a triple axel, but it's really not by much. Whereas moment of inertia, they found it decreased by about 400% from single to triple. So there was a huge difference in how skaters change their body position as they went to try to do those more revolutions. And then lastly, angular momentum, it increased by about 20% from single to triples, which again, helpful, but not quite as much as moment of inertia. So overall, the finding was that skaters tend to use moment of inertia over angular momentum in height to increase their angular velocity. So now let's talk about the landing. The landing is widely acknowledged as one of the most critical elements of a skater's program. So obviously skaters aren't in the clear once they've finished all of their rotations. And as you may know, or maybe not, but this isn't easy to do. It's estimated that skaters impact the ice with about 5 to 8 times their body weight. So if we've got a 130-pound skater, that means that they're hitting the ice with 650 pounds of force on one leg over and over and over again. And so if we remember the law of reaction, the force that the skater is impacting the ice with is equally transmitted up into their body. And then kind of just a fun fact, research suggests that it's not so much the height of the jump that's responsible for these high magnitude landing forces, but more so the result of higher angular velocities. Now, these skaters are spinning fast. For a triple axel, it's about 5 revolutions per second. And then at the landing, they need to be able to stop rotating as quickly as possible so that they can keep their balance and just kind of glide into the next skill in the program. So let me see, the free leg will end up getting pushed forward and around, and then the arms are going to extend away from the body. Both of these are going to increase their moment of inertia, thus slowing their angular velocity. And ultimately, it's the muscles and joints that need to be able to absorb these high magnitude impact forces. So like Dr. Gem talked about, skaters need to be very controlled in their movements and strong in their landing. Now, let's look at, this is kind of the ideal landing position for a jump, any jump, not necessarily just figure skating. We want to see slightly flexed hips, knees, and ankles. Unlike this athlete who's doing landing from a squat jump, or if we're talking about a volleyball player landing from a spike, the skater has much less time to align their body in this ideal landing position, because this crouch positioning is going to help absorb some of the impact forces and kind of send it through the lower extremity a little more safely than being extended like this. So again, I keep saying it, skaters really need to be able to find a balance of maximizing time in the air, so increasing that vertical velocity, maximizing their angular velocity, so that they can have enough time after they've finished their revolutions to kind of align their body for a safe landing. And in general, coaches and skaters may not talk about landing forces all that often, but this research is still fairly new, definitely ongoing. And this research is going to help us understand how to keep skaters healthy, how to keep elite skaters performing at a high level longer, and ultimately keep skating safe as a sport for anybody participating. Now, of course, there's consequences to doing these jumps. To learn and hone a new technique, it takes repetitions to get it down, yet these repetitive impacts from the jump landings are linked to chronic overuse injuries. So how can we make training more efficient and lessen the chance for injury? Well, we can use motion capture and EMG. This is equipment that we have at Boston Children's Hospital and the Micheli Center. And we want to use this equipment to evaluate timing, sequencing, kinematics, kinetics, so some of the things we talked about today, and then also muscle involvement. So which muscles are being activated, when are they being activated, and how much are they contributing to the overall movement? And overall, this equipment, it helps us observe and evaluate things that the human eye can't see. Because these jumps are happening so fast, it can be really difficult to isolate how skaters are generating and timing some of these factors. So all in all, we can use this equipment to work with skaters, coaches, strength and conditioning specialists to identify and correct inefficient movement patterns. So In terms of biomechanics, there's not necessarily one right way to execute and land a jump. There could be a fairly equal balance between maximizing angular velocity as there is with maximizing time in the air, or it could be weighted kind of one more so than the other. And really that's okay. At the end of the day, it comes down to the individual performing the jump. And this goes for all sports or any movement, not just figure skating. So really the take-home message here today is that jump success depends on the physics involved. So you know a little bit about that now. And then the individual performing the jump. So what their body type is, you know, their mass, how they're able to change the distribution of their mass, and their strength and flexibility. So I encourage you to keep this in mind when training and doing your strength and conditioning. And these are some references. So thank you. Any questions? And this.
No question. Amy, is Ellen. So you knew I'd have 5 questions, right?
You can bring it.
That was great. Thank you.
You can start your video.
Who?
You can start your video.
Oh, I can start my video. Okay, sorry. Again, techno loser. A lot of times, and I've heard coaches instruct in this, entering the axle, skid the edge.
Yep.
Slow down. And how is that going to affect the angular momentum?
That's a great question. Can we come back to that in a few minutes, actually?
Sure. Yeah, I mean, I think that's something, as I was watching this, and I also noticed in that young lady, the series of images, it looked almost like at the moment of leaving the ice, she was outside of her rotational circle. And I wonder if that comes from the...
Yeah, so they want to come in, you know, kind of at an arc, and that is ultimately helping generate more angular momentum. It's kind of putting their body, aligning their body in a way that they can swing that right leg around and start rotating their shoulders and their hips. Yeah, I'm not super familiar with skid. I'm kind of new to figure skating.
Yeah, well, the skid, you have to, it's like you're pushing more force, and almost like you're stopping.
Starting to turn that blade.
Turn that and swing the back of the blade around a little bit, which I feel like is going to slow them down. I mean, if you watch competitions, you see kids go powering in there at a huge rate of speed, and then they come to almost a complete stop, step up, and try to jump.
Right, and that we want to minimize coming to a complete stop. But being able, that's kind of what I was saying about being able to push down on the ice with that kind of like sideways at an angle. Right. That is, so the more force that they can do that with, and it needs to be controlled. They can't just be doing this willy-nilly. Yeah, that is going to get transmitted up, but also to start that turning. So we want some, but not, you know, there's kind of... Yeah,
it's that balance. I think that gets a little lost in some of the instruction, and it is not always advantageous for them.
And again, it comes down to skaters need to be very in control of what their body is doing, and to be able to use these forces in their favor to help propel, you know, upwards and around.
Yeah. Perfect. Thank you. You have other questions, so go ahead.
Okay. All right. So we are about to start doing, the question was, are you doing 3D analysis currently on the ice? So this is actually really exciting. We did just buy a new 3D motion capture system. It'll be 30 cameras, and these are going to be, we're just waiting to get them installed, but they'll be installed above the ice. So we will be able to start doing this soon. And we do have an EMG system, which we've been able to, we haven't done anything officially with it, but we have been able to play around with it. And it's a very, very powerful tool. And then next question was, how are harnesses used to help skaters learn jump? And are they always used? So I'm actually going to defer that maybe to you, Dr. Gem or Ariel.
Sure. I think the harness, they're not used all the time. It's like a harness, and it almost looks like a fishing pole, Amy, and the coach will pull them up so that they get the feeling of rotating in the air. You know, not everybody uses them. I don't think they're detrimental. I'm not sure they have like a huge value because the skater ultimately has to generate that force up themselves. But if the coach can guide the pattern of movement and the direction of movement, I think that can teach the skater's body what it has to do. Okay, similar to like the spinner. You know, have you seen the spinner, Amy? It's in the West rink, and you know they basically get pulled up and have to spin really tight. And I think that's valuable to learn how to get a tight position, but it doesn't help you at all how to get up there because you're pulled up there.
I think too, like one big thing that people, I think need to realize is that the harness shouldn't become a crutch. I feel like the harness is so helpful for a skater when they're learning a jump. I mean, obviously when you're doing a jump, it's very quick, can be very scary. And the last thing you want is a kid to go into a jump hesitant. So I do feel like it really just helps you kind of get over that mental hump as well. And also, again, having the person understand where their body should be in a safer way. But I do feel at some point, once that person gets it, I think that you need to start steering away from that harness, because if you continue, they're never going to get their timing right, because the timing on a harness and the timing without a harness are so different that they're never going to be able to master that skill. So I do think that like you have to be very conscious about how often you're using the harness and just making sure that you're not, you know, overusing it and kind of extending it too much.
Great. Awesome. Thank you. All right. So another question here. It seems that biomechanics and physics both play an enormous role in figure skating, yet coaches typically don't have this background. Where do you see the education on physics for the athlete coming in and then off ice as well? So this is something that I think we'll be offering biomechanical analysis as a service. So we can have, this is something that we could have a skater come to us. It would probably be us three, actually. That would be the team to do so. And we would have the skater come in, we would have them, you know, do some just regular skating and then also jumps. And we can kind of, we'll create like a report that the skater can take to, you know, strength and conditioning specialist, or we can also create like a list of exercises that they can do. I don't know if you want to pop in, Ariel, at all here, but
yeah, well, I mean, obviously from what we've kind of spoke about is that obviously what we get on the ice will help us kind of understand what the skater needs off the ice and things that we can maybe address to help them, you know, get over that issue that they're having in their jump. So, you know, whether we notice that they're having a certain hip position or they're not engaging a certain muscle that should be engaged during a certain part of the jump, we'll be able to analyze the jump, kind of see at each point of that jump where it's the takeoff or, you know, the exit, and seeing if there's something that is triggering and that we can address in the gym or even on the ice. So I think it's going to be really helpful to kind of help that skater almost like troubleshoot a jump, essentially.
I think, Ariel, your background is unique in that you were a competitive pair skater and you have a degree in kinesiology. And whoever asked the question, to the point that, you know, coaches don't typically get any training. They're not required to have any training. Some seek it out and learn, but most just kind of teach what they were taught. And so it's a culture that has evolved over the 100 years or so of U.S. figure skating. Yeah, I'm going to say in my tenure with U.S. figure skating the last 25 years, there's a little, you know, people are like interested now, but they're not lining up to learn yet. anyway. So that's what we hope to achieve by demonstrating some actual scientific knowledge, data to say, okay, here's what's happening with the physics. Here's how your skater can do this more efficiently and safer.
Thanks for the collaboration on answering those questions.
Hey, it's a team.
We can move on to Ariel right now. And again, if you have questions that are related to what Amy talked about, what Dr. Gem talked about, you can still leave those at the bottom. But for now, we'll spotlight Ariel and she'll share her screen, and then we'll have time for more questions at the end. Oops.
All right, screen share. Perfect. So, all right, so the anatomy of the figure skater. So I'm going to finish off talking about, injury prevention and strength training and how that applies here. So the topics of discussion, we're going to talk about warm-ups, when, why, and what. We're going to talk about the fundamentals of human movement. We're going to talk about movement comparisons. I think that's really important to understand, movements on and off the ice that definitely help transfer over. We're going to talk about key components of strength training, as well as a training periodization for a figure skating athlete. So for the warm-up, when should we be doing each part? So you want to make sure you're starting with foam rolling and then moving along to mobility and passive stretching, and then going into some dynamic stretching, dynamic drills, and then movement prep. So again, it's really important that we're not just getting to the rink and we just start running around in a circle. You want to make sure that you're giving your body time to get that proper warm-up done. So why do we warm up? Why is it super important? Well, it increases our body temperature. It increases our blood flow to the muscles, which increases oxygen delivery. It increases our heart rate. It prepares our muscles and joints for the demand of the sport. It enhances our motor control and our coordination. It stimulates our central nervous system, so our brain, and it decreases risk of injury. So again, a lot of things here that are super important to make sure that we address. Now the what. Foam rolling. I love foam rolling. I feel like not enough people understand what it does. And I feel like if they understood exactly what foam rolling was, they would do it a lot more. So what is foam rolling? Foam rolling is a myofascial release. So the fascia is that thin tissue that connects our muscles, and this packaging helps our muscles cooperate together. Now, when should we foam roll? Immediately prior to your workout for acute benefits, and every day for long-term benefits. So again, you can't just foam roll once every full moon and hope it does something. Why do we want to foam roll? We want to manipulate the nervous system tone, so essentially the level of activation and tension, and that's going to help improve our muscle function and our imbalances and allow us to move with ease. So when fascia is healthy, you'll feel more flexible and more supple. But when the fascia is unhealthy, we're going to feel trigger points. We're going to feel muscle soreness, inactivity, stiffness, and inflammation. So how, right? People don't understand how foam rolling actually works. Well, our bodies produce a substance called synovial fluid. And this fluid helps us lubricate our joints and in turn allows us to move around more effortlessly. Now, it is important to understand that we're not making any physical changes to our tissue, right, when we're foam rolling. Now, mobility versus flexibility. A lot of people think that they're the same thing, and they're not, and they definitely both have their places, but it's really important to understand the differences between both. So mobility is actively achieving a range of motion. So it's the movement of a joint, it allows for some moveableness, and it helps improve our articular function. Whereas flexibility is it's passively achieving a range of motion. It's the lengthening of a muscle, and essentially it's useless range in a sense because, again, it's passive. You're having gravity help you. You're not actively getting to that position. And it also has a feeling of being bent or broken in half. So here are some pictures and examples of what it would look like and why it's different. So as you can tell, the mobility exercises are more active. Flexibility, you're kind of just holding that position and allowing gravity to help. Now the warm up, again, the what, we have our dynamic stretching and our dynamic drills. So examples of those would be knee hugs, knee cradles, quad stretches, single leg reaches, reverse lunges to overhead reach, etc. And then dynamic drills would be, our high knee skips, our high knee side skips, our high knees, butt kicks, straight leg skips. Again, things that help us increase that body temperature. Movement prep now. So for movement prep, we have 5 different things we want to kind of target. We want to have our squat patterns, noticing here at that top left corner, lunge patterns, top right. We have single leg hinge patterns. So that single leg bridge position. Another type of squat pattern would be that lateral squat here in the middle. And then we have a single leg reach at that bottom left. And then we have an upper body push as well as core, which would be that bottom position. So again, trying to trigger and target every part of the body. So now understanding the fundamentals of movement. Now there's a thing called the joint by joint approach. And this is something that I do hope more figure skating coaches understand and take more time to, focus on when it comes to their athletes and their concerns. So if an athlete comes to you and they say that their knee hurts, it's kind of understanding how to, troubleshoot and how to understand where that pain may be generated. So although your knee may be hurting, it can be due to the joint above and below. So as you can tell here for stability, you have that lower and mid neck is for stability. Our shoulder blades are for stability. Our low back is for stability. Knees are for stability, and our feet are for stability. Whereas the joints of the upper neck, the shoulders, the upper back, the hips, those are meant to be mobile. So every joint has a different purpose. Now, if my hips are tight and they're not mobile, then my low back or my upper back is going to have to be mobile to compensate for that lack of movement. And that's where those injuries start to happen, because I'm not allowing those joints to do their job. The other joints above and below are going to help out. So a lot of times, if I see a skater with knee pain, most of the time it either is due to their hips or their ankle. And with them being in a boot all the time, their ankles end up being very stiff. They don't have very high ranges of motion. And it can be due to the fact that their ankles can't bend properly, that their knees are having to overbend and can't be stable. So here are some kind of some examples. If you have limited ankle mobility, like I had mentioned, knee, so potential knee valgus or anterior forward translation, your low back may have excessive rounding during squats. So if my ankles aren't mobile, those things can happen. If I have limited hip mobility, again, with my back, can have also excessive rounding trying to touch my toes, or my knees can have an increased load because they're lacking mobility and stability. So again, those are some examples of why it's super important to understand the joint by joint approach, and making sure if a skater does come to you with pain, that you think of those things when you're trying to address them. And to continue on that fundamentals of movement, certifications like the FRCms, which I do have, those types of certifications, I'll have you understand a bit more about, how the joints are moving, how they work together, and how they should be working, and how to also acknowledge any, asymmetries or limitations that someone may have. Now, movement comparison. So one big thing that I want to make sure as a figure skater or as a figure skating coach is to kind of understand why the off-ice portion, does translate on the ice and how it can be really helpful. So right now on the left, I have someone going into an axle takeoff, and off the ice, the exercise called a skater squat basically looks the exact same. So those 2 exercises, those 2 movements work the same muscle groups. The benefits of a skater squat: it increases depth and range of motion. It increases our eccentric control. So eccentric meaning when the movement is coming down, so you being able to control the weight as you come down. So the supporting leg when you're bending into the ice. And it increases your isometric control, that free leg, right? So if we go back here, we have those, the muscles in the back of your leg, those hamstring muscles that have to stay strong. I want to keep that free leg strong. If my back leg is not strong enough to support itself and isometrically hold, that can be detrimental to my takeoff. It increases lower body strength. So obviously more power or more strength equals more power. So again, that's going to be really important to focus on when you're training off the ice. So our next movement comparison is the step-up jumps. So as you can tell on the left, we have a skater that is going into that axle in that takeoff position. And as you can tell, that takeoff position is very similar to the position on the right, with that left knee on the box. So we're really focused on getting that triple extension and working all those muscles through that posterior chain, through the back of that leg muscle, as well as some of the side muscles, right? So again, exercises like this can really help you gain that triple extension that you do need, like Amy had talked about, talking about the takeoff. You really have to make sure you're increasing the force into the ice. So exercises like this can really help you understand that triple extension, pushing off that toe and really getting full extension from the knees, ankles, and hips during your axle takeoff. And then in turn, that will definitely help you, again, increase your vertical velocity. So more benefits from that step up jump, increases explosive strength during the takeoff and initial push off, and it improves your coordination of your upper and lower body. So again, that's also really important to be able to do two different things with your upper and lower body and making sure they work cohesively. Another comparison, same exercise, but this time instead of being a body weight plyometric, I'm doing a weighted strength/power exercise. So sled pushes are absolutely phenomenal. I don't think enough skaters do sled pushes. Again, it's only concentric, so it's actually really it's low impact because there's no weight ever coming down on you. You're just pushing the sled as opposed to weight coming at you. And some of the benefits, it increases your force from the hips to the hamstrings to the lower leg and foot. So again, really works that triple extension, works your power on acceleration. It increases your strength, it increases your power. And again, it's low impact. So exercises like this, when Amy mentioned a skater who's 130 pounds, when she lands, she has 650 pounds of force coming down that foot. When you're doing sled pushes, you can push a sled that's 300 pounds safely and efficiently. The more strength you build, the easier it's going to be to sustain some of these forces and obviously reduce injury. The next movement is a lunge. So on the left, we have someone going into a Lutz jump. So as you can tell, very similar positions. Now, what I tend to see is a lot of these skaters going into flips and Lutzes, they're bending from their chest as opposed to their knee. So that's where, body awareness comes in, and why exercises off ice like a lunge are really important to do so that you understand where your body is when you're trying to do something. Because if your coach is giving you a cue and is saying, I need you to bend your knees, and you're bending forward thinking, yeah, I'm bending my knees, but you're not. So I've seen a lot of skaters come off the ice trying to do a lunge pattern and realizing, oh my gosh, their lunge pattern needs a lot of work. And then when their lunge gets a lot better off ice, they come back in the gym and say, oh my God, my flip was so good today. So you can tell that, having more awareness of where your body is definitely translates on the ice. So benefits, increasing single leg strength, increasing that single leg control, again, improving body awareness, which is a big one on this one. And it also lowers your risk of injuries compared to like a two-leg barbell variation. Now, again, a lot of people, when they're training their athletes or when people are just training in general, they like to do two-leg exercises, but it's so beneficial to make sure you're doing both legs individually, making sure that they're not compensating with each other and that they're building strength by themselves. Next movement comparison is a swing. So I was a pair girl, and double twist, triple twist, those ones are incredibly challenging and they're incredibly quick. So that initial push off when the girl is pushing off of her partner and getting that power from the hips before she turns is super important. Now, if you don't get that pop from the hips, you're not getting as much height as you need to be able to make the rotation and for your partner to catch you where he has to catch you. So again, what exercise can we help this skater with to build that strength is a kettlebell swing. Kettlebell swings are great because, again, they're only really concentric, because when that kettlebell is coming downwards, you're coming down with it. You're not resisting the weight when it comes down. So it's mainly concentric. And as you can tell, it works every muscle in your back and your posterior chain and the backside of your body. All these muscles are so important and useful during that initial takeoff and that twist. So again, benefits, increases explosive hip extension. It increases the force from your hips. It increases rotational power. So it helps you get the power that you need to rotate from that initial pop. And it's also really great for all rotational sports. And the final movement comparison, anti-rotation. So when you're feeling like you're over-rotating a jump, if you're not able to keep that tension and stay closed in your jump, drills like exercises like anti-rotation for core are so important. Now, I see a lot of skaters and athletes doing a lot of, crunches and Russian twists and things that are twisting and turning. And in a sport like figure skating, where again, you're getting 650 pounds of weight on that lumbar spine, when you're having to take on all that compression and torque on your spine, why are we doing that to you off the ice? It's not being effective, right? You want to train smart and hard, right? So any type of anti-rotation exercise is so important and so great for skaters, helping us control that force that's pulling us out of our center, and to essentially help us combat that when we're doing a jump and we are a little bit off axis. It'll help us get that strength to be able to save that jump and land it. So for the benefits, we have increases in spinal stability, increases in rotational trunk strength, improvements, or improves the ability to transfer force from the lower to upper body. And it's a safer core variation again, right? So compared to twists and crunches, it's a lot safer, it's a lot more effective, and we're not, adding more torque and compression to that person's spine. So to kind of reiterate what I had mentioned prior, the warm-up, we have our foam rolling, our mobility and passive stretching, our dynamic stretching, our dynamic drills, and our movement prep. From there, we have our plyos and our sprints. So for power development, we have strength training, which includes all basic patterns and movement. We have conditioning and recovery. So few myths here for strength training. Now, our sport is unique, so we need to train differently. Now, the fact is that basic strength training is similar throughout all sports. So that's one thing to really take into account. I think a lot of people try to make it way too specific to skating, when really it's a very baseline training program with small modifications, obviously, for us as skaters. And then the next myth is practicing and doing more jumps will make you jump higher. Now, this one is not my all-time favorite. Unfortunately, no, jumping a bunch of times doesn't actually make you jump higher. Strength comes before power and speed. And that's not necessarily my opinion, but that's just physiology. So again, you cannot be powerful without strength. Now, before creating a program, what's really important to address is that athletes should learn the basic patterns first, right? So we want to make sure that they understand that hip hinge, that knee dominant, exercise, having them understand each one at the baseline of it. Athletes should progress from simple to complex. Now, again, sometimes it seems like the fun thing to do the exercises that look cool and fun, but you really have to make sure that athlete has a really strong foundation, because at the end of the day, simple still works. And even the simplest exercises have huge benefits. So, don't underestimate those simple exercises, and, let that skater build up to more complex exercises, let them, have that evolution. Periodization should vary between phases of high volume, high intensity, and unloading. So, you shouldn't be doing the same amount of reps and the same amount of weight all the time, because you're not going to get that physiological change. And lastly, programs should use the concepts of progressive resistance, and you should be making sure that you go up in weight. Now, a lot of people think that lifting more weights will make you bulky. Now, again, that's a really big myth, and that's also a misconception. When you have more muscle mass, a pound of muscle and a pound of fat don't look the same. A pound of muscle is a lot smaller than a pound of fat. So obviously, you gaining more muscle doesn't mean you're going to get bulky, right? Bodybuilders have to eat, sleep, and dream bodybuilding. They have to do a tremendous amount of stuff to be that size. So, making sure that you understand that progressive resistance is super important to make sure we have strong muscles on the ice. Now, for those movement patterns that I was previously talking about, we have hip dominant movements, which is the movement is driven by the hip. We have knee dominant. We have horizontal and vertical push. We have horizontal and vertical pull. And then we have torso and core exercises. So here's kind of how you would pair exercises on a 2-day program. So we have that power and plyo section at the beginning. So we're working on some rotational power, some single leg hops, med ball slams, and crawling variations for core. On that day 2, we have some anterior, some forward power. We have, 2-leg box jumps. We have lateral bounds, and we have plank walks also for core. As you can tell in that second portion, on day 1, I have my 2-leg hip dominant, whereas on my day 2, I have my 2-leg knee dominant. So making sure that I'm giving myself those 2 days to work on both of those. And if I'm doing a 2-leg hip dominant on one day, I'm going to do a 1-leg knee dominant on that same day. So again, giving yourself that full body workout on both days, but making sure that we're giving those changes. and how that would look written out with those exercise choices. And I also kind of put some conditioning drills to kind of give you an idea of what that would look as well. So on day 1, you'd have some bike intervals, 10 seconds on, 20 seconds off for 8. And then on day 2, I'm having some sled pushes, 15 yards each way, resting, making sure my heart rate comes down to about 65% before I go again. So periodization. So this is kind of what it should generally look like, but it's really important to understand that periodization is never going to be perfect. It depends on the skater's competition schedule. You know, if they get injured, obviously everyone's program, their yearly plan are going to differ from one skater to another. And there are obviously going to be sometimes some mishaps or some changes that need to be adjusted. So it's really important to make sure that you're speaking to your trainer and letting them know your competition schedule, making sure we plan for those tapers when they need to be done prior to competing. And also making sure that if you need to rest, that we plan that accordingly as well. We want to make sure that no skater is burning out, and that we're, you know, helping them recover when they need to. This picture kind of to show you how there's 4 different types of periodization, and they're all, you know, valid. So just because your periodization may be different from someone else doesn't mean that your program isn't as efficient. So, you know, there's different types of programming that you can do for the same athlete. And then understanding, you know, what the parameters would be for our sport, right? So exercise tend to range between 4 and 8 reps. You're not going to be doing 1 rep maxes again, especially when you're really in season. The last thing you want to do is you know, have you get hurt. We want to make sure you're maintaining strength and doing small increases of strength as well. Sets will end up being 2 to 4 sets per exercise, making sure you have about 5 to 10 seconds of rest between sets, but then between full sets, you'll have about 2 to 3 minutes. And usually frequency would be about 2 to 3 times a week when you're during your season. And that is it for me. All right, let me see how to unshare this. Oh no, yeah, there we go. Oh, I don't know if I'm unsharing. Oh, we're here, there you go. All right, Stacy.
Looks like Dr. Gem has a question.
Yeah, of course, right? I always have questions. That's how you learn, right? So, you know, I think of patients I see in the office and, you know, soccer players or football players especially, and they come in and, you know, they're so tight. They don't, you know how to stretch. I'm like, okay, show me how you stretch your hamstring. He's like, well, I stretch my hamstring. All right, show me. And it's not even a hamstring stretch, first off, half the time. And if it is a hamstring stretch, they have no clue where they're supposed to be doing it. So my point to them is always that the technique and the method of how you execute exercises, flexibility, and as well as strength, right, is key. And so there has to be somebody, aside from what these kids tell me, oh, I looked on YouTube, or my big brother showed me, or the seniors teach the freshmen, you know, I'm like, oh God. You know, I'm like, okay, let me help you. You know, I'm assuming that those concepts obviously apply to this as well. So I think for the parents and for the athletes, you know, if you don't feel like you're getting what you're supposed to out of the exercises, you know, ask questions about the technique. I mean, is that?
Yeah, well, I think for myself, like with these skaters, even though I see them, you know, multiple times a week, I'm constantly asking them, like, where are you feeling that? Does something feel off? Are you feeling okay? And even before starting any strength training program, I'll start the day with saying, hey, how are we feeling today? Is there any pain? Is there any achiness? Is there anything you want to tell me before we start? Because again, it's our job to adjust those programs accordingly. If they're feeling, you know what, I'm feeling really tight today here, you know, taking the time to making sure we address that and giving them the tools that they need to help that, I think, again, it's really important. So I think that being very transparent, being very vocal with your athlete and making sure you ask them questions, because sometimes they won't say anything because we're athletes. Like I was an athlete, like showing pain is showing like weakness. Like I'm not going to tell you I'm in pain. So I think, you know, being very honest about it and giving your athlete that platform to speak up, I think is going to be really helpful to keep them from getting injured. Because again, they're not going to speak up until it's too late and then it's too far gone. So I think, again, it's really important for the person who's in charge, the strength trainer or the coach, to really, you know, make sure that they ask those questions so that their skater feels comfortable. Oh, I think we have a question. Yep. If there is a PT With chronic issue on landing a jump off ice, would you work only eccentric exercises or combine an eccentric and a rotation as they would be doing landing? I mean, obviously, if they're having chronic issues, it depends on also where the pain is, if it's in the hip, if it's in the back, if they're having, and depending on where the pain is. Also to training, generally, I let pain be the guide. So I would make sure, obviously, that we're not doing anything that's too weight bearing, trying to make sure we're, supporting the whatever joint. If there was a lower back, I wouldn't be doing anything that implements the back in there. We can always use certain exercises where, we have ring assisting or we have the foot supported. So there's certain exercises, again, with someone like myself, I know how to regress an exercise to a point where we're targeting those muscle groups, but not putting any additional stress on the joints surrounding it. So again, it really depends on a case-by-case position. I think, again, if that person's having chronic issues and it's back pain, I'm definitely not going to be doing anything that's going to cause rotation to the spine. So I think, making sure that you know exactly what joint is bothering you, we can address it further during training. Here, at what ages can we begin working with strength exercises? I mean, we have athletes here that are, I think we have the youngest kid that came into a class, I think was 6. But then again, we're not going to be having some of these kids lifting weights. I think, doing basic movements, like, again, squat patterns, hinge patterns, you can do so many exercises, body weight. And I think with a lot of the younger kids, it's just understanding more developmental movements. Like, can they skip? Can they crawl? The amount of kids that have come in for some skating evals that can't skip is very troubling. And it makes me kind of worried because, again, if they can't skip, how are they supposed to do an axle? How are they supposed to understand the coordination that an axle takes if I can't get them to coordinate their arms and legs during a basic skip? So I think, doing things like that, ladder drills, having them, be able to coordinate agility. There's so many things that we can do off ice that don't really necessitate any weights in general, will be beneficial for a kid. Mind you, I think too, when they're very young, I think it's so beneficial to put them in other sports too, like have them play soccer, or have them, go play at the park. I think a lot of people, underestimate the value of things like that, and making sure that they're doing different variety of movements. So I think that's really important to address when they're young. But again, it depends on their level of skating. If someone is doing, working on doubles, then yeah, I would definitely want to make sure that they're in the gym working on things that we can help them with, but without, putting a hic in their development.
Yeah, Ariel, I think you make a good point, because at that young age of, till about 10 or 11, majority of it is about neuromuscular control, like teaching your brain how to control the body, and then challenging the body with some resistance, or even your own body weight is often enough to build that strength and develop that coordinated movement. And then once they have that down, then they're not going to be making these compensatory movement patterns. And, so you're just better off. Previous question, Jamie, she does a training thing down on the South Shore. Very similar concepts to dancers in terms of, over the standing leg, what to do with the gesture leg, the core, rotational stability kind of exercises are important.
Yeah. I think too, with a lot of the younger kids too, a lot of it's like, a lot of them are hypermobile. A lot of them just don't have any control. So just like you said, doing isometrics, or doing like static holds, doing eccentric work, like just body weight eccentric work can be so helpful for them, when it comes to having more control over their body on the ice. And as they're young and they're growing, you start kind of losing body awareness. So I think, again, things like that can be super helpful. There's another one. At the moment of takeoff, if you don't want to slow down and skid, should a skater then no longer be on the outside edge? Also, what effect does fast twitch versus slow twitch muscle fibers have on skating movement, especially jumps? Can fast twitch muscles be improved, and how? Asking as an older skater, I feel slower and it is impacting jumping. What would you recommend? So great question. Again, for the takeoff, I think that's something that's really, it's very specific. I do see the reasoning for having that slight skid, like Amy had said, you want to put more pressure on that initial foot to have a stronger takeoff. But again, things like that you can do off the ice, strength training and getting stronger acceleration power, stronger press off, can at least maybe help you alleviate from skating so much, because you have the strength to get into your edge a lot more and you don't need to skate and compensate with that. So again, those things will really depend on who's coaching you and what you're doing off the ice. So I think, again, it kind of is a case by case and you have to be watching the skater. When it comes to the fast twitch, slow twitch fibers, you know, strength training, I think, is going to be really helpful. Again, like I said, to help you jump higher and jump better. Plyometric training, especially for more adult and general population, will differ a little bit from skaters, at least where you're going to start with yours as opposed to some skaters. So even things as much as like a drop squat, where you're not actually jumping, you're just kind of coming up into a triple extension position and dropping quick. So working on how you catch yourself in a landing as opposed to actually jumping and landing can be really helpful. So maybe you need to kind of start at a different progression and build your way back up while also implementing strength training. I think that those two things together are going to help you be as quick as you need to. But I think just, you know, just strength training or just jumping is not going to be enough. Doing them together is going to be really, really helpful. And also doing exercises for agility or for speed, you know, like ladder drills, things that help you kind of have a quicker reaction is going to, again, help you with that timing. So I think things like that, essentially some of the things that I spoke about, are going to be really helpful, but they have to kind of come together. You can't just take one thing and think that one thing is going to help. It has to be a cumulative program.
And I think also, you know, the composition of your muscles, fast twitch, slow twitch, that's kind of a genetic thing.
Yeah.
You know, you can't like make more fast twitch fibers or more slow twitch fibers. And I think that's sort of a genetic theory, and maybe in part why, you know, they've done some of this genetic analysis to see, you know, what sport this particular individual child is going to excel at. You know, sprinters have more fast twitch fibers and, you know, that kind of stuff. That doesn't mean that you can't prepare and train otherwise. And I don't think skating is such a sport that, you know, you would have to have all of these fast twitch fibers in order to execute things. What you need is stability. And if you can be stable, you can generate incredible force, get off the ice, rotate, and come back down without killing yourself.
Exactly. I think that was the last question.
Ooh. Does anyone have any last remaining questions for any speaker here? If anything comes up that you have a question on, you can always email us too, and I can pass it along to them as well. Any closing statements you have?
No, I think this was great. I thank you very much, Ariel and Amy, for participating, and thank you everyone in the audience for you know, spending some time on a Saturday morning to learn more about this. And, you know, this is a work in progress and is going to continue to develop, is my hope, you know, to make this a better sport. That's how other sports have improved, by research, by investigation, by asking questions of, you know, why is it this way and why shouldn't it be that way, and how do we figure it out? So I'm excited to pursue that. Yeah. It looks like another question.
They're just saying things.
I just responded to, I just typed the responses.
Oh, okay. Sorry.
Thanks so much. This was super informative and provided a lot of food for thought and action. Thanks for joining us.
Yeah.
That was the goal, to get you thinking, get those wheels rolling a little bit.
Yep.
And thank you to Dr. Gem, Amy, Ariel for joining us this morning virtually. I really appreciate you guys doing this. And thank you everybody out there in the cyber world for joining us. We hope you enjoyed it. I will send you a survey link and a recording of this later on in the week.
Yeah, and
have a great rest of your day.
For any of us, you know, call the Micheli Center, or if you're at the club, stop by and ask to get some questions answered, etc.
All right. Have a great rest of your weekend.
Bye.